Hi, everybody. I'm Dr. Mattioli, owner of Origins Incubator, where we help providers successfully launch a membership based practice. So, today we're going to be talking about the length of membership. What is the best way to determine how long that this membership should be? So there's a lot of questions that I get within the program. And I just want to share with you what my experience has been developing my own membership and how that evolution looked in terms of successful patient care. Because at the end of the day, that's the ultimate goal. So I currently operate a 12-month membership with lead-in appointments. So I have a discovery call, an initial consultation, which is a foundational assessment, and then at that point, the decision is made whether to move forward with the membership. Currently, my membership includes 5 visits with myself throughout the course of 12 months, in addition to 3 visits with my health coach and one long 90-minute appointment with a therapist. Both of those providers are independent contractors. So, how did I determine this 12-month program? And did I find that there was barriers with patients committing to that amount of time? These are the questions that I typically get from providers. And I find that a lot of times providers want to start like, okay, I'm just going to do an 8-week or 3-month or something like that, like a shorter program length. We're just going to discuss kind of the pros and cons to that. So the initial thing that a lot of people will say is doing a 12-month membership, like that's a lot of commitment for the patient to sign up for. How does that conversion occur? So my solution to that is by having a very clear, not confusing, not overwhelming lead-in process that includes the discovery call and the foundational assessment. So at the discovery call, what we do is we are basically introducing the patient to the practice in general, and I'm discussing with them how I would approach their specific case, what that would look like. If that conversation goes well, then I say to them, okay, well, the next step would be the foundational assessment. This is a one-time appointment. It's a 90-minute appointment with myself, where we do a deeper dive into your blood work and we discuss foundational support such as nutrition, stress, sleep, exercise, things like that. So I'm getting both subjective and objective data at that appointment so I can clearly discuss what that membership would look like. So that is a very meaty appointment. We're spending 90 minutes together. We're going through their history from birth. We're really identifying the imbalances in both their external and internal environments. At the end of that appointment, then I now have all of this information about the patient, where I'm basically evaluating them and saying, okay, now the next step, if you choose to move forward, is a 12-month membership. The reason that we do the membership is because healing takes time, and I want to be able to kind of run alongside you as things might come up, and so we can make changes along the way. It's very important that you email them about the membership before the foundational assessment. So we have an email that we send out to people before they come into the foundational assessment, where I am in a video, which is an attachment to the email. I'm discussing with them like why a membership. So I'm kind of discussing all of those barriers and why we operate the way we do. So it's important that the patient is kind of pre-educated. They shouldn't be learning about your membership at the end of this foundational assessment appointment. And for my current incubator members, all of that is in the incubator course. You can see the exact email and video that we send out, and you can kind of make it your own and go from there. But for the rest of you, I think that I just want to make sure that you understand it's really important to pre-educate. There should be no kind of surprises. This information is kind of dripped out throughout the process. So at the end of the foundational assessment, say somebody has their primary complaints, they have some endocrine disruption, maybe they have some hypothyroid issues, or chronic fatigue, insomnia, migraines, those kinds of things. I would say to them, and maybe some gut health things. So we would discuss any advanced testing that I would like to do at that point. So maybe I want to do an adrenal saliva test. Maybe I want to do a gut workup. Maybe I want to do further like food sensitivity or nutrient testing. So I based on the foundational assessment, I'm choosing which tests are appropriate for them at that time. And then I described to them, we can't do all the tests at once, and we can't treat all at once. So this takes time. It's like peeling back layers of the onion. I'd like to first identify food sensitivities and nutrient deficiencies. So let's start there, and then see how you improve over the course of 2 or 3 months. And then at that point, if it seems like there's some stress issues occurring, we might do the adrenal saliva test at that point, then treat that and follow up. So as you can see, like we're already at the 6 month mark, and we're still kind of peeling back the layers and treating your gut and your HPA axis, and we're kind of balancing everything out. When I first started, I realized that when I described it like that, patients really got it. And if they wanted a quick fix, like if they just wanted to see what their saliva test was, or just do the stool analysis, and and they just wanted the results, they didn't really want to work with me over the long term, then that was pretty clear from the beginning. But people who were really invested and interesting in really kind of this integrative holistic approach of the combination of lifestyle and internal and external environments, like they understood that takes time, and it takes time to see change. So initially I did 3 or 6 month programs, and I found that like most people can feel better in 3 months when you clean up their diet, you replace some deficiencies, you might do some gut support, things like that. But it's that you have to kind of follow them through those waves of behavioral change and how the body responds. And so I just had found that I wanted to kind of continue to see them like through those 12 months, so we could have those ups and downs and really get them to a solid place. And if you're implementing a protocol either for gut health or adrenal health, a lot of times it takes 3 months, 2 to 3 months to see a change. Like you have to consistently be doing the recommended interventions. And so if you're doing a 6 month program, you're basically seeing them initially, you're reviewing the testing results, and you're implementing it. And then you're following up in 2 to 3 months to review, like, how are you feeling? How are things going? And then you might retest. And then we're already at 6 months, and there's still kind of other layers to pull back and other things to do. So I find that the 12 months, and then we reevaluate at the end of 12 months. So then we say, are you at a place that feels complete, or do we need to move on with like a maintenance kind of approach? And that kind of continues as it does. Um, and I also want to point out that some people after that foundational assessment, just kind of responding to the deficiencies and things like that you might see on blood work, and doing that initial lifestyle approach, for some people that's enough and they don't need the membership. Like the whole idea is to kind of meet them where they are at each stage. And so that's why I feel pretty strongly that the 12-month membership with that initial consultation is so key to establish that relationship. And so they really understand in their unique setting and situation why we kind of need this longer term solution. I mean, they didn't get to where they are in a matter of 3 months. Like, we can't expect to unravel all of the imbalances and behavioral things that are involved with healing in a matter of just a few appointments in 3 months as well. So that's how I've set up the membership. That's what I teach in the incubator, and I highly encourage to consider that kind of approach for both your stability as a business and as a practitioner, but also for patient outcomes. I think it's a good thing for both of you. So if you have any questions, if you're an incubator member, please set up a coaching call so we can kind of review your membership and work through some of these things. And if you are not and you're interested in learning more about what we teach in the incubator, go ahead and set up a strategy session with the link. Thank you so much.